Lincoln. On same morning the law regarding sex care for minors went into effect. Nebraska Department of Health and Human Services issued 90-day guidance allowing certain care to continue. Approval of the emergency regulations came on Sunday after 4 months of uncertainty about what would happen next. As of Friday, there was little indication of when such rules would go into effect for puberty blockers or cross-sex hormones. If there were none, there would be a complete ban on this type of care. A DHHS news release issued Sunday states that Gov. Jim Pillen approved emergency regulations for blockers and hormones for minors. Arrangements prepared by Timothy Tesmer will begin on Sunday, October 1. Regulations require a minimum number of treatment hours before care. Define gender dysphoria, gender nonconformity. Establish guidelines for obtaining informed patient consent. And mandate a waiting period between consent prescription. In his statement, Pillen said he appreciated work Tesmer and his team in submitting emergency regulations for approval on date of entry into force law. These regulations provide necessary guidance to ensure that Nebraska children are protected from medical treatments and surgeries that could result in irreparable harm, Pillen said. Care pathway doctor from OneWorld Community Health Centers in Omaha, Alex Dworak, told Nebraska Examiner on Sunday that the regulations generally provide a way for people to get care they need. He applauded Tesmer for eschewing the political will that often denies the existence of trans youth. Dworak added that these guardrails follow current maintenance standards a little more thoroughly. If you had told me at the beginning of the year that after all this we would be standing here and have a detailed pathway that seems me be thoughtful and well thought out, allow people get care, Dworak said. It would have been a much better year if I had known this was coming the whole time, he said. Dworak said there are some concerns, such as a lack of mental health professionals or qualified providers, especially in rural parts of the state. But he said regulations will help ensure they are carried out carefully and accurately. I think Dr. Tesmer has fulfilled his oath as a physician, put patients' interests first and strive in good faith sanctify the pathway care. Dworak said. He did not bow to political pressure to abandon these patients or his medical colleagues. Dworak and others said Sunday that while final regulations are still being shaped, lawyers will monitor the process and ensure the regulations do not become a de facto ban. Final regulations timeline Bill 574. Passed in the spring. Also bans gender reassignment surgeries before the age of 19. Effective Sunday. The law states that there must be rules and regulations regarding the continued prescription of blockers or hormones. The regulations will remain in effect for 90 calendar days and may be extended once. DHHS expects final regul.